I'm going to invite Dr. Carla Coven to give her welcome remarks. Now, I'm just going to say a few words about Dr. Carla Coven. Dr. Coven is a liver specialist, of course, and she's also the professor of medicine at the University of Calgary. And she's a clinician scientist who does research on hepatitis B. And she has served in expert review panels for many international organizations, including World Health Organization. And she has helped in establishing the Canadian Hepatitis B Research Network, and she's the current president of the Canadian Association for the Study of the Liver. So let's welcome Dr. Carla Coven.
So as Kalina mentioned, we are here to bring together the community to talk about hepatitis B, to provide education, and to also learn from the hepatitis B community of what you want from what we can do better in our care and research. And please welcome to ask questions, and we are happy to answer them. So my talk is about the past, present, and future. It's hard to know where to start in terms of the past, but I think a good place is to introduce you to Dr. Baruch Blumberg, who you may know. He was a famous scientist, and he was based in the National Institutes of Health. And he is the person who is credited with discovering the hepatitis B virus, and it was almost by accident. His research was related to genetic traits, and he was funded to go around the world and collect blood samples from different groups and communities. I'm not sure he would get ethics approval to do what he was doing at that time in the 1950s and 60s. But anyway, based on his research, he found a protein or a special chemical in the blood of a person from Australia that happened to be indigenous. And further study identified it to be the main protein associated with hepatitis B, that is the hepatitis B surface antigen. This very important discovery led to the discovery and invention of the first hepatitis B vaccine in the late 1960s. Introduction of this vaccine has subsequently led to saving many lives and reduced risk of liver cancer in many countries. He got the Nobel Prize in Medicine in 1976 for this discovery. I read his autobiography, and it's called The Hunt for a Killer Virus. And for those of you who are interested in sort of an interesting read from a perspective of a scientist, this is the book there. But we know hepatitis B has existed in humans for many, many years. And this was a publication in the journal Hepatology in 2012. At that time, the researchers found a mummy of a child that was 500 years old, and they were able to identify the liver that was very well preserved, and they were able to extract hepatitis B and sequence it, meaning look at what kind of strain the virus was. And they estimated that this strain had been present in humans for almost 10,000 years, or up to 10,000 years old. The first time hepatitis B was ever found in a mummy. We know Korea is one of the success stories in the world, in that now they have the hepatitis B vaccine and the rates have decreased significantly. But many, many years, obviously, from this study, we can see that people were living with hepatitis B in that country. So what about the present? So where are we today? So as many of you know, hepatitis B is the major global cause of liver disease and liver cancer. If you have a normal liver, the stages of disease can progress from developing chronic hepatitis, where you have inflammation or signs of damage to the liver, to very severe damage or scarring. The worst or most severe is development of cirrhosis. Hepatitis B can also lead to liver cancer. It can happen in patients that have cirrhosis, but also directly. So even if you don't have cirrhosis, you can go on to progress to liver cancer. Fortunately, today, we have very good drugs to treat hepatitis B. They're called antivirals or nucleoside analogs, They're pills that you take once a day. The names are listed here, tenofovir and atecovir. Treatment with these antivirals reduces liver disease, reduces inflammation, reduces cirrhosis, even causes improvement in liver fibrosis or scarring, and reduces the risk of liver cancer. So these drugs are life-saving, and Dr. Fung will talk more about treatments this afternoon. As I mentioned already, that the hepatitis B vaccine is a breakthrough in research. The World Health Organization has recommended that the vaccine should be given as soon as possible after birth in children. It is an anti-cancer vaccine. The reason why we recommend it in as young as possible is because if you are exposed to the virus, the risk of having a chronic or long-term lifelong infection is related to your age. So if you're only an infant less than 1 year old, if you're exposed, you have a 90% risk of having persistent infection. If you're a young child, the risk drops down to about 50%, but in an adult, even less, maybe only about 1%. Oh, I'm sorry, this is going too fast. However, in Canada, we do have universal vaccines, but not all provinces do them at birth or even in infancy. So this is listed, the provinces or territories. Only Nunavut and the territories and New Brunswick do it at birth. Other provinces do it at 2 months, and many wait until pre-adolescence, which is too late. I strongly recommend giving the vaccine as soon as possible. As they say, there's no cure for hepatitis B, but an ounce of prevention is worth a pound of cure. In Canada and globally, hepatitis B remains a major problem, even though we have a good vaccine that's been available for almost 4 decades. Globally, about 260 million people have chronic infection. Over 2 billion were exposed to the virus, but many are not treated. And there's estimates that about 1 person dies from hepatitis B globally every 30 seconds in the world. In Canada, we also have many Canadians living with hepatitis B. The Public Health Agency recommends about 250,000 Canadians. Maybe this is an underestimate because we also know many people live with hepatitis B and don't know about it. Even up to 40% of people don't know about it, and we encourage testing. And it's important to test people because then you can give them antiviral therapy to reduce the risk of cancer and cirrhosis. Our studies or other studies have shown, including my colleague in Calgary, that people living with hepatitis B have 3 times higher risk of death compared to the general population. And another important note to comment on is that viral hepatitis, so hepatitis B and another kind, hepatitis C, can lead to cirrhosis and liver failure. And the only treatment is a liver transplant. And giving a vaccine that only cost a few pennies could prevent a liver transplant that could cost over $100,000 and long-term stay in hospital, which obviously has very, very significant financial and economic input. And I gave this slide, it's a few years old, but in Alberta, and as of 2020, about 40% of transplants were related to viral hepatitis. As I mentioned, that many people in Canada have hepatitis B and don't know that they have it. Previously, we've had screening guidelines that said, test for hepatitis B if you have this, if you were born here, if you did this. But that is not a good way to find people because a lot of people don't remember, like, what are the risk factors. So we recommend, the Canadian Association for the Study of the Liver and many specialists recommend to screen everybody for hepatitis B, just as a one-time screen. And then you know whether or not they have it and whether or not they could benefit from getting the vaccine. And then we can identify people that would need or benefit from treatment. So I'm going to move on in terms of the timeline because I have to talk about the past, present, and future. So as I mentioned, we have a very good vaccine licensed in 1981. Universal vaccination was given in Canada starting in the early 1990s, but not everybody was doing it at birth or in infancy, as you know. Interferon was the first drug that became available in 1991. It's an injectable treatment, but has a lot of side effects. We still use it today, but less often because of the side effects, and you can't give it to many people with advanced liver disease. The first antiviral, or the oral or pills, was lamivudine, that was available in 1998. One of my famous Canadians, Dr. Lauren Terrell at the University of Alberta, was responsible for discovering and advancing lamivudine treatment in Canada and globally. Entecavir is the next drug that became available in 2005, was an improvement in that it was more potent or had reduced risk of treatment not working or developing resistance. And then finally, tenofovir first became available in 2008, and then a new form of tenofovir was available or approved by Health Canada in 2016, which are very good drugs, very potent and safe. And from my earlier slide, you might remember showing that it reduced the risk of cancer and development of cirrhosis. These drugs are good, but there is some rare side effects, mainly kidney and bone. But the newer formulation of tenofovir alaflinamide, has less of those side effects, which my colleague, Dr. Fung, will talk about more at the afternoon's presentation. This is a busy slide, but I want to highlight that there's been many research studies looking at the benefits of antiviral therapies. So this lists all the names of the authors of the studies dating from 2012 up until in the late 2000s. And in this study, they looked at people that had received treatment versus those that did not get treatment. And in this very large study, I mean, they compared in over 59,000 people with hepatitis B. They showed that treatment reduced the risk of death, liver cancer, and liver failure. So this is an older study, but many other papers have been published also highlighting that treatment is life-saving. I want to comment on the fact that treatment is not easily available across Canada. And I think it is important that we have increased access to treatment, increased access to universal pharmacare. Currently, the government is hoping to approve access to diabetes medications and to contraception, but access to hepatitis B antivirals is important. You can go to some countries and buy these drugs for only a few $100s, whereas, for example, in Alberta, our patients may have to pay up to $2,000 per year. Even with Alberta Blue Cross or the government-assisted program, it's very expensive. And I want to please highlight and talk to your members and talk to the public about we need to get more access to these drugs for our patients. So I'll finish off with the future. Hopefully, I'm not going to go over time. The World Health Organization has recommended that everybody with hepatitis B should be vaccinated as soon as possible after birth. They recommend 90% of people should be diagnosed and that 80% of people should be on antiviral therapy. Canada is not necessarily meeting all of those goals by 2030. We do have good vaccination coverage, but many people don't know they have hepatitis B. And as I said, many people may not have access to therapy. So I'm putting a plug out in this first forum to try and work harder to achieve these WHO goals. What about a cure for hepatitis B? We're going to talk about that later, but as you may know, there are many new drugs that are coming through and being tested, and we're hoping that in the next few years, we'll have better drugs that we're able to cure hepatitis B. Soon, it may be the first wave in the next couple of years. This is a very busy slide, but it just sort of highlights from what all the research that is being done by scientists to try and find a cure for hepatitis B. And there's great hope for the future. So in summary, I hope everybody knows here that hepatitis B is a major global health problem, and in Canada, we need to do more to meet the WHO Health Organization global targets to ensure that everybody gets the birth dose or the hepatitis B vaccine as soon as possible after birth. We should do more to screen people and make sure that they could get connected to care and receive treatment. We need to make sure we meet patients or meet the community where they need and provide public education and translations, such as what we are trying to do today, and also to improve access to life-saving therapies. And finally, there's great hope for a hepatitis B cure. Please advocate for research on hepatitis B so that we will be able to move towards finding a cure. Thank you very much. It's a pleasure to be here today. And my
Thank
last
you.
slide is
Yeah,
just
thank you very much, Dr. Carvin. And it's a very, I would say, informative talk. So to make all of us aware what's happened to hepatitis B in the past, present, and future. So I think Dr. Carvin's made a very nice summary at the end, reminding us the World Health Organization's hepatitis B elimination plan by 2030. And of course, being a hepatitis B support community here, I think we all need or should sort of play a role in helping to spread the word and really make the public more aware of hepatitis B.